Hi there, I'm Jennifer Collins, and this is my father, Dr. Robert Douglas Collins, and he is a neurologist. I think the main thing is I'm one of his patients, and I really wanted to bring awareness to people about what headaches really are, migraines, and brain tumors, as well as I wanted to dispel the myths about back pain. And so here we are. Hi, Dad.
Hi, great to see you, daughter. It's just a pleasure. And just ask me any questions you want, and I'll do my best to answer them. So that, and one of my gifts is simplifying things, so I'll try to make it easy for your audience to understand.
Great. Well, the first thing I wanted to ask you is about headaches. Okay. Let's just dispel what it is to have a regular headache versus a migraine.
Okay, well, there's three main types of headaches that the average person gets that are not associated with really serious pathology. And the first one, of course, is the tension headache. And most people with the tension headaches get it in the occipital area, and it can last all day. And of course, it comes from exactly what it says, from tension. You're keyed up about something, you're worried about something, so you get this headache, and it can last for days, or it can just last for a couple hours. Usually it will respond to Excedrin, Tylenol, some of the over-the-counter medications. So we don't see too many patients with tension headaches in the neurologist's office. And even primary care physicians do not see them. Now your next headache, and the most important, and of course the one that is incapacitating, is the migraines. And migraines come in like several varieties. The classical migraine is a one-sided headache, right or left, or it can alternate in the individual. And it's usually preceded by an aura, which could be any neurological symptom you can name. It can be blindness, it can be dizziness, vertigo, where you feel like Alfred Hitchcock's movie, Vertigo. It can be paralysis on one side of your body. It can be numbness and tingling on one side of your body. It can be unusual tastes or smells. It can be a seizure, but that's rare, thank goodness. But like I said, it can mimic almost any neurological condition. You don't have the headache during that phase, because what's happening then is constriction of the blood vessels. And the most common one is just zigzaggy lines in front of your eyes, or a blind spot in the eyes. It's most common. There is a kind that looks like a fort, the old forts in the Western movies, from the air. You know, they look like almost a hexagon. That's probably one of the common auras. Then, when the blood vessels, after being constricted and being deprived of oxygen for a little while, then they dilate up. And they dilate up mostly in the temporal artery distribution here. That's why when a patient comes to me with a migraine headache, I can diagnose it very easily just by putting my finger in front of the ear and feeling the pulse there of the temporal artery and compressing that. And I'll do it on both sides so that, I don't push their head one way or the other. And then that will relieve the headache. As a matter of fact, I teach my patients to relieve their headache that way, and many times it's successful.
Oh.
So that's one. And sometimes it's located in the occipital artery distribution, which would be back here. It rarely is ever in the facial distribution, because that's another type of headache that we're going to discuss. But the migraines, common migraines now, are not on one side or the other. They're all over the head.
Oh.
And the migraines are typically associated when the headache phase comes in with nausea and vomiting,
Yes.
and sensitivity to light and noise. I mean, you want to go
And
into a
scent.
quiet room, and smells too, but not quite as bad. So you want to go into a room. An unusual type of aura, going back to the phase before you get the headache, is when somebody gets totally disoriented.
Okay.
And it's called global amnesia.
Okay.
And they don't know where they're at, and that's an unusual. I wanted to be sure to mention that.
Okay.
But at any rate, the migraine Common migraine is all over the head, whereas your classical is usually one side or the other.
Okay.
Associated with nausea and vomiting. All types are associated with nausea and vomiting, and with photophobia and acousticophobia, or sensitivity to noise and light.
Oh, and we were going to also at this point take a break, and we'll be right back with the triggers of the migraine.